So much for joining us here today. I'm here to give an update on COVID-19, and I'm joined virtually by Pat Allen, Director of the Oregon Health Authority, Dr. Dean Seidlinger, our state epidemiologist, and Dara Isaacson, a special guest joining us today. Dara was diagnosed with COVID-19 several months ago, and unfortunately is still experiencing chronic symptoms. She's here today to share her story with us. With our first positive test on February 28th, Oregon had the second case in the nation of COVID-19 not connected to travel or other known cases. Despite having one of the earliest outbreaks, and even with the dire challenge of the recent national surge, Oregon has the fifth lowest COVID-19 case rate in the nation. I know this is in large part due to the tremendous efforts of Oregonians who continue to take actions to stop the spread of the virus. Yes, we've done relatively well compared to the nation as a whole. Unfortunately, as of today, more than 1,120 Oregonians have lost their lives to COVID-19. I don't want to lose one more. I know that Oregonians have sacrificed a lot, but we cannot sustain these sacrifices forever. That's why we're planning to do everything we can as we gear up for the vaccine campaign of our lifetimes, including distributing adequate supplies of vaccines to Oregon communities as quickly as possible, prioritizing our vaccine distribution among the hardest hit and most at risk. We will decide our priorities using an equity lens with input from a diverse range of community voices. So we have the full buy-in from communities who, despite having endured the worst health and economic effects of the pandemic, have historical reasons to be wary of public agencies and the established healthcare system. And we will be launching an intensive and culturally responsive outreach effort to build trust and confidence in the vaccines, especially among communities of color and other vaccine hesitant communities, so that we can achieve a vaccination rate that gives us the critical mass of immunity we need to eliminate COVID-19 in Oregon. By the end of December, Oregon expects to receive 147,000 doses of the Pfizer and Moderna vaccines. Oregon is a national leader in rapid statewide distribution of vaccines against vaccine-preventable diseases such as influenza, measles, mumps, and rubella. We have a proven, efficient, and reliable system for distributing vaccines through a broad network of healthcare providers, health systems, local public health programs, our tribes, and community nonprofits. With 94% healthcare coverage rate and 1.4 million members of the Oregon Health Plan enrolled in our innovative, cost-saving, and primary care-focused coordinated care organizations, we have the policies and programs in place to vaccinate all Oregonians. And we're pulling every single one of those levers. State health officials have been enrolling vaccine provider sites in the COVID-19 vaccination program so that we can begin allocating doses of the vaccine to those locations within hours and days after they arrive in Oregon. Our hospitals will be the primary sites for immunization of the first group of vaccine recipients. State health officials have set up a statewide cold chain network of locations that can provide ultra cold storage for the Pfizer vaccine, which has to be stored at about 94 degrees Fahrenheit. That's a negative 94 degrees Fahrenheit. That's really cold. We estimate that approximately 100,000 Oregonians will receive their first vaccine doses by the end of the year. With 300,000 case healthcare workers in the state, The first doses will be prioritized for staff who work at hospitals and other inpatient facilities and have direct patient contact, especially with our COVID-19 patients. That will include people in vital roles like housekeeping and food services. We'll then expand to outpatient and other settings, including behavioral health programs and facilities that meet the needs of people with intellectual and developmental disabilities. We believe that prioritizing all healthcare staff and patient-facing roles, not just our medical professionals, is a necessary first step in rectifying some of the health and social inequities of the pandemic. We think this step will also help slow community spread, especially among communities of color who comprise a disproportionate share of the workforce among non-medical staff in hospitals and at our nursing homes. Next, we need to vaccinate essential workers. As you know, states are responsible for making difficult decisions about how we prioritize the heroes who've kept us going throughout the pandemic. The Oregon Health Authority has put equity at the center of our state's COVID-19 response. Through OHA, we've funded more than 200 nonprofit, community-based organizations to help with contact tracing, maintain housing, get meals to struggling families, and provide mental health support. We'll draw on these relationships, along with our connections to other stakeholders, to convene a vaccine advisory council that will inform the way we prioritize people working in essential worker roles. More to come on that soon. We also believe authentic and equitable community engagement is vital to achieving community immunity in Oregon. If our communities don't have a voice in deciding who gets a vaccine and when, state health officials won't be able to win the trust and confidence of people our healthcare system has failed to serve well. And we'll continue to see unacceptable health disparities and low vaccination rates across the state. You've heard this before, but I'll say it again. The vaccines won't save us from the pandemic. Vaccinations will. In a September survey, only 4 in 10 Oregonians said they would be certain to get a COVID-19 vaccine. So we certainly have our work cut out for us, especially in an environment poisoned by the current administration's polarization and politicization of the pandemic response. As we wait for wide distribution of vaccines, one of our most important challenges is to remind Oregonians to keep up your guard. We need you all to keep wearing masks, limiting get-togethers, and maintaining social distance until we achieve community immunity. Thank you. Thank you for your actions so far, and thank you in advance for continuing them over the holidays and in the difficult months ahead. This vaccine arrives in the throes of a raging pandemic that our current administration has done as much to aggravate as mitigate. States are doing what we can, but a competent federal partnership has been missing. Oregonians are hurting. We need federal support to keep Oregonians in their homes and keep our businesses across the state operating. It's absolutely true that we're all in this together, but the impact of COVID-19 hasn't been borne equally or equitably. We're all in the same storm, but we are not all in the same boat. In Oregon, we will need to vaccinate more than 10,000 people per day to immunize 3 million Oregonians, or about 3/4 of our state. That's the scale we need to achieve community-wide immunity. It's a tall order, and we can't do it without federal resources to deliver the doses and support our distribution and outreach efforts. And until we can reach those coveted levels of immunity, we must all stay the course and continue to practice the safety measures we know can make an impact and stop the spread of the virus. I am so very grateful to the majority of Oregonians who are following the recommendations of our public health experts by physically distancing, wearing a mask, and limiting gatherings. Still, there are some who feel they are invisible to the virus, that they can't get it or they can't spread it. And when they don't follow public health measures, their actions put all of us at risk. Data shows that more than half of Oregon's cases are among people under 40. So it's not just the elderly that get this virus. Unfortunately, a lot of young people are at serious risk. And just because you're young doesn't mean you automatically can survive the virus or escape with few symptoms. I want to introduce you to a brave young woman, Dara, who's here with us today to share her experiences with COVID-19. Speaking to Dara, what really left an impression on me is not only that she's been suffering from the effects of COVID-19 for months, but also how difficult it has been on her family, including her 5-year-old daughter. I'm going to let her tell you more. Dara, the mic is yours.
Thank you, Governor, and thank you for what you're doing to help protect Oregonians and save lives. And thank you for letting me share my story today. And I'll try and get through it without breaking down. My name is Dara Isaacson. I'm a native Oregonian. I grew up in Gales Creek, right outside of Forest Grove. Went to SOU, worked at Crater Lake, currently live in Southeast Portland with my husband, Ben, my 5-year-old daughter, Bailey, and our dog, Luna. This year, I got COVID for my birthday. I turned 40 on March 2nd. And unfortunately was unable to celebrate or enjoy my mom's cheesecake she had made for me because I was in bed with racking cough, terrible body aches, unrelenting headache, 102.7 fever, and extreme fatigue. I actually don't remember many of the days I was initially sick. Little did I know I would still be sick almost 10 months later, and with more symptoms than my initial infection. I'm a COVID long hauler, and there are thousands of us across the country dealing with debilitating, long-term, chronic, possibly lifelong symptoms due to COVID. Many of those long haulers, like myself, were very active, healthy, no underlying health conditions, working out, taking care of the kids, getting things done. And, my family loves to hike and bike and camp and canoe. And we didn't do any of that this summer because I can barely walk around the block now, 10 months after my initial infection. And I know many people, especially younger people, feel that this virus is not a threat to them or that the risk of catching it is low. Many think it's not worth the precautions, the masking, the distancing, the social isolation that some of this has caused. Some people think that this is just like the flu. I can tell you from personal and horrible experience that way of thinking is extremely dangerous. This is an unpredictable and terrifying disease. It's been almost 10 months after I first contracted the virus. I'm still alive, thankfully, but my life has been completely turned upside down. I still have a wide range of symptoms affecting my heart, my lungs, and even my brain. I've been to the ER 3 times since June. Prior to that, I had never been to the ER in my life. There are nights where I wake up gasping for air. On a bad day, I have such bad muscle tremors and muscle weakness that I can't hold a computer mouse. There are times I cannot stand up long enough to take a shower. I've lost 20 pounds over the course of this unintentionally, and I don't have the strength to gain them back. On really bad days, I'm bedridden, and I've essentially been housebound, not because of the restrictions put in place, but because of this illness for 9.5 months. I haven't been able to work for months, and many of the things I love to do, reading, biking, hiking, are off the table. There will be no skiing this winter for me and my family. It's hard to lose some of those things you love. I think the hardest part, though, is the effect that this has had on my family, especially the relationship with my 5-year-old daughter. I can't play with her anymore. I can't go out on adventures with her. She now has my husband take pictures or videos when they go for a hike or take the dog out of what she's doing so she can bring them home and show them to me, because I can't be a part of it anymore. A few months ago, she told me, "I wish you were like a real mommy." And that was truly heartbreaking. It still brings me to tears every time I think about it. And I realize how hard this has all been for all of us for so many reasons, especially the lack of social connection. And I know how hard it is to be away from family, especially during the holidays. This was the first Thanksgiving we haven't had my mother-in-law here in 6 years. It's exhausting to be vigilant about mask wearing and keeping your distance and sanitizing your hands or even your groceries. But I can tell you that the alternative is way more exhausting. I realize that most of us don't like to be told what to do, especially when we feel that we're not necessarily part of the problem. But I believe that now all of us have the opportunity to come together to be part of the solution. Oregonians look out after one another. It's one thing I love out of many about this state. During the wildfires this summer, neighbors came together, bonded, and helped people with the wildfire response. They stepped up. They didn't think twice. Now we need to step up again to protect one another from this devastating virus. This is not the time for blame or arguments. This is the time to make some sacrifices so that we can come together and keep this virus from harming any more families like mine. Thank you very much.
Thank you, Dara. Thank you for sharing your story. We wish you the best, and please give your family virtual hugs from all of us. With that, I'm going to turn it over to Dr. Dean Seidlinger to give us an update.
Thank you, Governor Brown. I'm Dean Seidlinger, the State Health Officer and Epidemiologist. Thank you, Dara, for sharing your story. My heart goes out to you and your family, and I hope that as we learn more about COVID-19, we find ways to help you recover, to get back to doing the things that you love. I'd like to start out today by acknowledging everyone who is suffering from the impacts of COVID-19, both the illness itself and the secondary impacts from the virus. You may be someone like Dara who's battling COVID-19. You may be someone who's lost a loved one or a friend. You may be someone who's lost a job, or you're struggling to keep your home. Or maybe you're someone whose life has been disrupted and devastated in all these ways by COVID-19, because I know that's a hard reality for many Oregonians, especially in communities of color. And every one of us misses the human fabric of daily connection that the virus has strained. A friend's casual hug, celebrating a wedding or a birthday together, holding the hand of an elderly relative. Here's an update on the status of the pandemic in Oregon. our situation remains precarious and concerning. But there's evidence that the protective measures Governor Brown has taken in recent weeks, backed by the actions of Oregonians, may have blunted the current surge. And as the governor discussed, safe and effective vaccines are coming to Oregon. So first, the bad news. We continue to set records for new cases in Oregon. Last week, we surpassed 10,000 cases in a single week. As of today, 30 of the state's 36 counties are considered at either extreme or high risk based on case counts and test positivity showing widespread disease in their communities. Today, we'll cross the threshold of 90,000 cases by adding 1,611 new diagnosed and presumed cases. Worse, and tragically, we're also experiencing record deaths associated with COVID-19. Last Friday, we surpassed 1,000 deaths since the start of the pandemic in Oregon. And on Tuesday, we surpassed 1,100. As of today, the statewide COVID-19 associated death toll is 1,138. So I want to stop and reflect on what these losses mean. Each death marks the anguished end of a lost battle against the virus. Each death leaves a hole in someone's life. Each death cuts short love, laughter, and memories for families and friends. And each death means a neighbor, a fellow Oregonian, will not be here to ring in the new year with the rest of us. And every single COVID-19 death is avoidable. That's why Governor Brown has taken action. That's why we come to talk to you each week. So now let me turn to another troubling indicator. We're also seeing record numbers of COVID-19 hospitalizations. We currently have 576 hospitalized patients with positive COVID-19 tests in Oregon, and as of yesterday, 127 people in intensive care with COVID-19. The upward trend is extremely worrisome. The number of people hospitalized with COVID-19 is up 70% since mid-November. All but one of our 7 hospital regions has experienced a surge in bed demand. Many hospitals have eliminated or dramatically scaled back elective medical procedures to free beds and staff for the deluge of COVID-19 infected patients. This delay, it delays needed care that Oregonians deserve. The rise in daily cases, hospitalizations, and deaths are consistent with our recent modeling, which showed that the virus is spreading exponentially among us. That's the bad news. But there is good news. We haven't observed a marked increase in the cases following the Thanksgiving holiday. Our cases are still rising on average, but there's evidence they're not rising as steeply. Over the past week, Oregon has had one of the lowest case rates in the country, according to the CDC. If our rising cases begin to abate, we may be able to stave off the worst case scenario our recent model forecasted. So I'd like to thank you, Oregonians, for the changes and the sacrifices you've all made. We saw a decrease in people's movement before Thanksgiving. A national survey showed Oregon had a high percentage of people who reported you were going to spend the holiday with only members of your own household. These decisions, hard as they were, likely slowed the increase in cases. We're not yet seeing the rapid rise in cases we feared, and that's good news. It's a welcome departure from case spikes that followed previous holidays. This could still happen, and we need everyone to consider the risks of the actions they're taking and to reduce your risks as much as you can. Most important, it's a direct result of the decisions the majority of Oregonians made around the Thanksgiving holiday. If we can avert worsening this crisis, it will be the result of the simple but serious and life-saving steps every Oregonian take every day. Wear a mask. Avoid large get-togethers. Keep your distance. Wash your hands. And observe the social distancing protections in place in your county. Here's some more good news. Our colleagues in the Oregon Department of Human Services are expanding their network of COVID-19 recovery units to 7 long-term care facilities statewide. In total, we will add more than 200 beds at facilities in Bend, Medford, Portland, Roseburg, Salem, and other communities. These dedicated units give the state more flexibility in responding to COVID-19 outbreaks in long-term care facilities. Just as significantly, they will help ease demand for hospital beds statewide. So all these steps mean that we still have an opportunity to bend the case curve down again, avert our worst fears, and spare hospitals from being overwhelmed so that all Oregonians have access to the high-quality care we deserve. So once more, I want to thank you, fellow Oregonians, for the hard work you've done to protect yourselves and your family and your neighbors. And I need to ask you to keep up your guard, especially now that we expect vaccines to arrive in Oregon next week. Last week, Public Health Director Banks, OHA Director Allen, and Governor Brown all accepted a challenge to take the vaccine when it becomes available and when their turn comes to take it. I too want to accept that challenge, and I will take the vaccine as soon as it's my turn, whenever that time comes. In the coming months, many of you will also have a chance to save and sustain lives by taking the vaccine when it becomes available. I want to encourage you to take it as soon as you can. In turn, OHA will provide accurate, transparent information about every aspect of the vaccine, from continuing to follow the safety and efficacy to how we're prioritizing who can get the vaccines and how we're distributing them across the state. And with that, I'd like to turn things back over to Governor Brown.